Hi, I'm Aldrich-Bennett, a physiotherapist, and this is Barcode Play Show.
Hi and good day. Welcome to Spotlight, powered by Barcode Play Show. Today's show is sponsored by PASS, and I'm your host, Ilechukwu Alex. Welcome. Today we are excited to welcome back Dr. Aldrich-Bennett, a renowned physiotherapist, joining us again for our second edition. Last time, Dr. Aldrich-Bennett shared valuable insights on physiotherapy and physiotherapists, who, what, and how. You can check out the previous edition on YouTube or Facebook. Today, we will dive a little deeper into physiotherapy and look at two critical areas: cryotherapy and correcting bad sitting and standing position, if we have the time. Let's welcome Dr. Aldrich-Bennett. Good morning, Doc.
Good morning.
Yeah, welcome back to the show.
Thank you so much. It's my pleasure.
Okay. I believe Abuja is wonderful today.
Yes, it is.
And yesterday's independence celebration.
It went quite well.
Wonderful. Okay, now let's start. Can you explain cryotherapy in simple terms? You know, it's a big word, it's a large word, cryotherapy. So can you bring it down to a layman's term? Cryotherapy, explain it in simple terms.
Let's break the word into two, which are the key words there: cryo and therapy, making up cryotherapy. Cryo means ice or cold. Therapy means treatment. So when I'm talking about cryotherapy, means treatment of injury or lesion using low temperature agents like cold water, ice, cold spray, and anything cold being used to treat an injury. That is cryotherapy in simple terms.
Okay, like the kind of treatment we see footballers receive on the pitch when they have a certain degree of injury.
Yes, when they have simple injuries like sprains, strains, you see them receiving the cold treatment. That is cryotherapy.
Okay, why do you recommend using cold therapy for fresh injuries instead of hot treatment like hot water or abonic balm or all those balms that are really hot when you apply them?
Now, when somebody has fresh injury, like you put it, which we call acute injury, that is injury that occurred seconds to minutes to hours to days and a few weeks old. The injury, that area becomes a little bit inflamed or warm to touch and sometimes swollen. The temperature is a little bit higher than it ought to be. Assuming I have a wrist sprain, after some time, you may touch it, it may be swelled, it may be warm to touch and swollen and a little bit painful. So the ideal thing is to reverse that inflammation, drop the temperature by using something cold. When you apply abonic, essential balm, or all those things that are hot, you're already increasing the temperature. And if I were to be fair, the place will be reddened. So what we use is to bring in a cold agent, cold temperature agent, to calm the place down, reverse the inflammation, give you pain relief. Then healing process can take place. We have a lot of them in the market. Cold spray, for example. Now I have one here. This is a cold spray. So if I have a wrist sprain, all I have to do is to apply it. It's as simple as this. So I'm not going for something hot. There are hot sprays in the market, but for acute injuries, we recommend cold spray. So it's going to reverse the inflammation. It's going to calm the place down, make it less irritable, drop the temperature, and promote healing. So that is why for acute injuries, we recommend cryotherapy or cold treatment instead of the hot ones.
Okay, well, an offshoot from this question before I go to the third question, is it something that one can apply on his or her own at home? Like, let's say there was a time I had a sprain and I think I called you and you told me to go and get a cold spray, which I tried to find. and at some point I couldn't get it around, and you told me to apply. I should get a sachet water that is already in the freezer that is cold, and I should apply. So is this something that one can actually do at home, or do we need to go to a physiotherapist to help us achieve that?
That brings me to various types of cryotherapy application. We have about 9 of them. Some you can do on your own. Some somebody can teach you. Some you must have to go to the hospital. So it depends on which type. If it's for a cold spray, yes, all you just need to do is to read the instruction, or if the therapist tells you how to use it. If it's a cold cream you want to use that contains diclofenac instead of methyl salicylate or menthol, yes, you can use it. So it depends on which type. That is the answer to the question. Some you can apply on your own. Some you have to go to the hospital. And somebody has to teach you, show you the best way to apply it. Then you can go ahead.
Okay, probably in our future episodes we can look at those areas we can apply on our own, and then the ones that we can go to the hospital. What sensations do people typically experience during cryotherapy?
Now let me use one of the techniques, which is ice massage, to explain it. Ice massage is when I get an ice block, a chunk of ice, and use it to massage an area. Let's assume in my wrist sprain. So immediately on application of the ice, the person feels a cold sensation. If the person does not feel the cold sensation, then the treatment stops, which means something is wrong. The sensory integrity of the place is compromised. So on application of ice on the body, there will be cold sensation immediately. Then after some minutes, let's say 1 to 2 minutes, it starts feeling like it's as if it's burning. It's not only fire that burns, ice burns also, but just a feeling that will pass. After that, the person starts feeling like aching within 2 to 4 minutes, like it's aching. Then the last stage is the numbness that sets in between 5 to 7 minutes. So it's that numbness we are targeting at. So the place that used to be very, very painful, when the numbness sets in, it calms it down. It reduces the nerve conduction velocity to the brain, so which means the brain is not perceiving the pain as it should. So when the place is calm, from that 5 to 7 minutes, we leave the ice there for about 15 minutes, then terminate the whole process. Remember, I say ice massage, so you don't just leave a raw ice on the skin. It's going to burn the place. So if it's ice massage, you need to be massaging it around. So you have cold sensation, burning sensation, aching sensation, and numbness. These are the 4 stages on application of ice.
Well, I hope in wrong application, one does not have a frostbite.
Yes, wrong application, you have frostbite or ice burn. Frostbite is the advanced stage of ice burn. So ice burn is like the skin will break down. That is ice burn. Frostbite is the advanced stage. It may be irreversible. So that is why we need to know what the method the person is applying, and teach him. But for something like an ice spray, a cold spray, and those ones don't come in, all I need to do is to stretch the area, keep it a little bit away, and spray into and fro fashion. That's just it. So this one does not predispose me to ice burn or frostbite, just in a to and fro fashion. That will give me the result.
Okay. Although in my 4th question, you've touched it before, but either we can skip it or we can just run on it on the surface level. How can cryotherapy be applied, and what are the different methods?
Okay, let me start with the different methods. We have about 9 of them. We have ice massage. We have ice towel. We have cold spray. We have immersion technique. We have whole body cryotherapy chamber. We have cold compression unit. We have contrast bath. We have excitatory cold, and a few others, like 9. So if we are discussing a cold spray now, what we call a vapor-cooling spray, this one. So all I need to do is to stretch the area I'm applying. Assuming we are going back to discussing my wrist again. If I bend the wrist this way and I'm spraying here, this is not stretched. This is where it's stretched. So if I want to spray here, I bend it this way so that the surface area is increased. I'll keep this away, few inches, 3 to 4 inches, and spray in a to and fro fashion. If I want to spray this side, I have to bend it this way and spray. Then that is for cold spray. And if I want to discuss ice massage, all I need to do is to go to the refrigerator, bring out an ice chunk, hold it with a towel, go to the area of the body and use it to massage it around. I don't leave a raw ice on it. We have ice pack also. The one you see that is popular, maybe it comes with a blue pack or a black pack. That one I just place it on top. Because it's inside the pack, it's not a raw ice. Keep it there. It goes through the stages of cold feeling, burning sensation, aching sensation, numbness, and I leave it for 15 minutes and I remove it. So it depends on the type you're applying. So they have slight differences. If it's for immersion technique, it then means I can crush ice, put it in a bowl of water or in a bucket of water and dip the extremity, let's say the leg or the hand inside, still leaving it for 10 to 15 minutes and removing it. If it's contrast bath I want to do, then I have warm water and cold water. So I now put it in the cold water, maybe for 1 minute, and remove the limb and put it in the hot water. When I mean hot, I'm not talking about burning hot, I'm talking about slightly warm. I now put it in the one for 3 minutes and take it back to the cold, that is contrast bath, for a cumulative time for about 20 minutes. So it depends on the type I'm using, and that will be determined by the area I'm going to treat and what I want to achieve.
Okay, thank you, Doc. Before I ask you our fifth and sixth question, we have someone sent in questions from the last time we had an interview, and then the person is asking. Were asked. He said, my uncle miraculously got out of a 6 months coma, but can't walk or do anything properly. What type of physiotherapy treatment can be used?
Ideally, when somebody is in coma, regardless of the cause, and the vitals are stable, when I mean the vitals being stable, I'm talking about the blood pressure, the heart rate, the respiratory rate. A physiotherapist is brought in to move the joints around full range. Every joint has full range. The person is in coma, so I'm the one doing it for him. That is called passive movement. Move the joint, all the joints, stretch the muscles for the person 1 or 2 times a day, so that when the person wakes up out of coma, he won't be stiff all through. It's only in a bad scripted movie that you see somebody that has been in a coma for long comes out without any musculoskeletal defects. So if the uncle has been in coma and wakes up during the time the person was in coma, we go there and do passive range of motion movement. And when the person comes out, we now reassess and see what are the musculoskeletal deficits and take it off from there. So congratulations to his uncle. I wouldn't know why he went into coma, whether it's diabetes, whether it's stroke, or whatever it is, whether it's head injury, but whatever it is, the uncle ought to have had physiotherapy while in coma and physiotherapy after coma, after assessment.
Someone also asked, for a stroke patient, is there a point of no return, or are all stroke patient issues curable at some point? I don't really understand. Now the person is asking, is there a point of no return? If you have stroke, is there a point of no return, or are all stroke issues curable at some point?
Now, let me give you an answer that by telling you there are 3 types or broad categories of stroke. The first one I'm going to discuss is called TIA, transient ischemic attack. A blood vessel in the brain is clogged by a blood clot. So when that happens, the person presents with stroke. But in a blood vessel and there is a blockage, blood will keep on building up behind the blockage. If the blood pressure is able to push it out and blood flow is restored, the person comes back. It happens within few hours to maximum of 3.
Thank you very much. We invite you back on the show in due time. Thank you very much. It's been enlightening to explore the power of physiotherapy with Sir Aldrich-Bennett. Remember, movement is medicine, and we are grateful for the dedication of professionals who help us to heal and thrive. That's it today on Spotlight, sponsored by PASS. I remain your host, Aldrich-Bennett Alex. Have a pleasant day. Remember, wealth is health. Bye.